Today, we are going to discuss and celebrate the Rabies Day. The slogan last year was that one health, zero deaths, and now the slogan of this year, 2023, is all for one and one health for all. Today, we are going to discuss that how to provide the information to the peoples uh, to aware them that the rabies is a dangerous disease, a lethal disease, it's a fatal disease caused by a virus, and around in the world, rabies kills 50,000 people and millions of animals each year. हम सबको पता होना चाहिए कि ये रेबीज एक डेंजरस डिजीज है जो ह्यूमन बीइंग को भी किल करती है और इसके साथ साथ ये एनिमल्स के लिए भी dangerous है and kills fatal. When it develops the clinical signs, nobody can or no animal can survive. तो इसका ऑप्शन यही है कि we should have to educate the people to vaccinate. Then the surveillance should be adapted that how many animals or human beings are being infected by a virus, and then we should have the knowledge about the rabies virus, and that should be diagnosed through a laboratory. And there should be a collaboration among the communities, the persons, the countries, and the all means in a blue color written all uh, on a slogan. That's mean that everyone plays a role for this control or eradication of the disease. Whereas the all in a green, which is written on a slogan, that means one health is for everyone. So one means the person makes a difference. One person can make a difference. There must be a one goal and one community to eradicate this disease. इस बीमारी के खिलाफ मुत्तहद होकर लड़ना पड़ेगा. Then we can eradicate this disease. If a person or animal gets rabies, they will almost always die from it, and there is no chance for a survival. Impact of the integrated approach of disease that is a specific target under the neglected tropical diseases of WHO. WHO ने टारगेट बनाया हुआ है कि 220 में 80 कंट्रीज को फ्री ऑफ रेबीज किया जाएगा और फिर 2023 में 89 कंट्रीज को जो अभी चल रहा है इस साल जिसका मकसद होगा कि 53% of the rabies from 53% of the countries of the world has been eradicated, and there is a zero death of the humans in those countries. It means all the animals and all the human beings are prevented from the disease. 2025 तक 113 कंट्रीज को फ्री किया जाएगा जो 67% है और 2030 तक जो है 155 कंट्रीज को फ्री किया जाएगा और जो 93% of the world. It means that 8% still remain even if we follow this program of a WHO up to 2030. Still, we have 8% of countries to be infected, or they might have the rabies in the country. It means we are not going to control up to a 0% or up to a zero level. So that means we have to work hard, and still we have to work after 2030 to control the rabies. Any mammals, cats, the rabies, the raccoons, skunk, foxes, and the bears are a carrier or a reservoirs of this virus, and the dogs, cats, cattle, and ferrets can spread the diseases in the flying foxes and the bears are also spreading the disease in Australia, but mostly in the endemic countries like Pakistan, India, they are spreading the rabies in a human being through dogs, cats, cattle, and ferrets. So this is transmitted by a biting of a rabid dogs or cats to the human being. और जब भी कुत्ता या फिर पागल कुत्ता या फिर पागल बिल्ली वगैरह किसी ह्यूमन को काटती है तो फिर ये स्प्रेड होता है. हाउ डू वी गेट दी रेबीज? जो इंसान या जानवर रेबीज को तभी उसको लगती है जब उसको कोई रेबिट डॉग या रेबिट कैट या रेबिट एनिमल काट ले या स्क्रैच करे. Mostly it is spread from a saliva. So saliva is a carrier of the virus which may have to be inoculated in the animal or a human being that might help to cause the infection in the animal and also produce the disease and then the death. So how does rabies make you sick? Like mostly the major target of the uh, this disease is the brain. So once inside the body, the virus travels along the nerves, it has to be targeted to a brain or a spinal cord, and then it has to cause the respiratory arrest, and that leads to the death. So animals that can give you the rabies, they are the raccoons, and they may have to get the uh, infected, and they may have to transfer for by biting to the human or to the other animals, and they can spread the disease. The bears are also responsible of catching a virus and then spreading it to other animals by biting or scratching the humans and animals. And then it is also the foxes are responsible for spreading it as far the virus is concerned. It is the fox is a reservoir of the rabies virus. Whereas skunks, when they are infected, they also transmit the rabies to the human and as well as to the other animals. So groundhogs are also the responsible for spreading the disease. The cats, which we are keeping in our homes, they should be vaccinated. And those cats which are street cats are unvaccinated cats. They are responsible of spreading the rabies if they are rabid. Then they can spread the rabies in the human being and even to the other animals. The dogs which are unvaccinated are stray dogs, they should be vaccinated, and the population of the stray dogs should be controlled because they are not being kept in the homes and they are not being provided the shelter and the health care. Therefore, uh, they remain unvaccinated when they live on a street. So therefore, they must be vaccinated so that to stop the spread of a rabies among the human being. So the ferrets, many people have ferrets as a pet and they should be vaccinated for a rabies. The mammals are less likely to carry the rabies, especially the rabbits, the squirrel, the mouse, and the rats do not carry the uh, rabies disease. So Lysovirus is not present in these animals. Even the animals do not carry the rabies. They are the birds, the ticks, the bees, the turtle are The snakes, they are not carrying the rabies and they are not infected with the Lyssa virus. So the signs which may develop after the biting of a dogs, the rabies of two types or of two forms have been seen. That is, one is the excitatory, the sometimes called the furious stage, and the paralytic, from also referred to as the dump stage. No all animals experience both stages and symptoms can vary. So the vicious erratic behavior means classic form, foaming at the mouth, heightened sensitivity to a visual and auditory stimuli, weakness or a paralysis, death from a respiratory failure has been observed in the animals having a rabies. Signs of a rabies in animals can include unusual behavior, the wild animals that appears friendly, nocturnal animals active during the day, and increase in the drool or saliva animal that acts very sick are mean animals that have a difficult moving or dead. That is the sign of the uh, rabies. The rabies can be confirmed only by the laboratory. The lab scientists test the brain of a dead animal and identify the Lassa virus from the brain. So the rabies can be prevented. Vaccines shots should be given against uh, the human being when being bitten by the dog or a rabid dog or a cat or any bat or a foxes. They should be given a post effective treatment, that's the vaccination against the rabies, and then wash the bite wound and scratches thoroughly and stay away from the stray dogs. So the wound should be and the post-exposure treatment was consist of a immediate scrubbing of the wound with the water or a soap, irrigating it with the varicidal agents like a 20% of a soap solution. That's iodine, and zero point 0.1 aqueous iodine or 40 to 70% of a alcohol. The best way to prevent the rabies is to make sure your pets are vaccinated against rabies. आपके अगर जो घरेलू जानवर हैं जैसे कैट है, डॉग है या कोई भी पेट रखने अगर वो वैक्सीनेटेड है तो फिर you are free from the rabies exposure and even the risk of a spread of a rabies. So you have to vaccinate your pet like a dog, cat, and a parrot, and always leash your dog and tell an adult if you see a wild or stray animal acting strangely. If your pet gets bitten by an animal, call your vet right away. So get your pets spayed or neutered and to stop and control the population. So these are the two methods that to control the rabies in the country. One is the vaccination of the all the stray dogs and as well as the cats and the pets, which is being kept in the home, and the neutering of the cats and the dogs is the one of the tool to control the population and then to stop the spread of the rabies. The dogs and cats should be vaccinated by the age of 12 weeks, and one injection of the rabies should be given at the age of 12 weeks, and the second injection of the rabies of 1 ml should be given after 1 year of age. So at the interval of up to 3 years, the uh, third dose should be given to the dog and the cats, whereas the horses should be given at the age of 6 months or one injection at the 4 month, and then followed by a second injection on the 1 month after the first injection. Then the from a 6 months of the age one injection, and then annually the vaccine should be given. The cattle and the sheep and goats should be given at the age of a 9 month, one injection at the 4 months, and followed by a second injection between the 9 and 12 months of age. Whereas if you are giving one injection to the cattle and the sheep and the goat at the age of a 9 months, then you have to repeat it annually. So the domestic animals should be repeated at the age every year, the vaccine of a rabies, whereas the dogs and cats should be repeated with the uh, interval of 3 years. Mostly the vaccines which are available in the market, they should be given at the age of 12 to 16 weeks, and then it should be repeated at 1 year, and then every 3 years thereafter the vaccine of a one animal should be given to the animals like pet animals, dogs and cats and ferrets. The rabies and other vaccines for dogs, uh, 6 to 8 weeks, uh, the puppy should be covered with a distemper and parvovirus, Bordella, the optional vaccination. The vaccine should be given at 10 to 12 weeks to a puppy. The vaccine should cover the distemper, hepatitis, parainfluenza, and parvovirus. So influenza, leptospirosis, Bordetella, and the Lyme disease are poor lifestyle as recommended by the veterinarians. So 16 to 18 weeks of uh, the puppy should be given with the vaccine against the canine distemper, hepatitis, parainfluenza, and parvovirus, whereas the rabies also should be started at the age of 16 to 18 weeks. Then again, at the age of 12 to 16 months, uh, the vaccine of a DHPP and the vaccine of the rabies should be given to the dog so that the coronavirus, leptospirosis, the Bordetella, and the Lyme virus may be covered. Whereas the every year, one shot of the DHPP, and after 1 year, every 3 years, the rabies should be given as per law. So this is the schedule for the uh, dogs and cats for all the diseases, which covers almost 6 diseases, and the Hexa dogs, Prima dogs, Hurricane, or even you may have to uh, use the Rapsin or the other manufacturers are providing the vaccine against the rabies or parainfluenza, hepatitis, parvovirus, and canine distemper or a feline distemper or a feline parvovirus. So you have a biofil or the biocell. So there are a number of the uh, vaccines for the cats and the dogs. So the rabies vaccine for the human being that is being produced in Pakistan, mostly the National Institute of Health is producing a vaccine of the SPV that is being purchased by the provincial governments and provided free of charge to the government general public hospitals. So the recommended regimen is given 2 ml of the 5% SPV suspension subcutaneously to the adult, and whereas the 1.5 ml in the children under the 12 years of age, and consequently for 14 days, and then a booster on 24 days and 34 days and at 100 days. So the vaccines, the potent cell culture vaccine given in a 5 intramuscular shots, that's known as the Eastern regimen, whereas the 4 intramuscular shot of Zagreb regimen means 211 that has reduced the dose of the intradermal regimen TRC, that's a 2222011 or viral 804011, and the ridge for the transdermal bites and a mucosal exposure, and the vaccines only for a minor scratches aberration can be given. Like the current, the TRC 2 sites intradermal rabies PAP, also showing a new 1 week 2 sites intraperitoneal the site or intradermal site. The two shots at the intradermal site of a 0.1 ml per site may be given uh, on the 0 day, and two sites on the 3 days, two sites on a 7 days, and then the optional is that the two sites may be given up to 0.1 ml of the vaccine after 28 days after the exposure of the human being bitten by the dog or a cat, rabid dog or a cat. अगर कोई भी इंसान, किसी भी इंसान को अगर पागल कुत्ता या पागल बिल्ली काट देती है तो उसको 0 डेज पे 0.1 ml दो साइड्स पे ये TRC 2 साइड्स पे देनी चाहिए, और फिर 3 डेज के बाद देनी चाहिए, फिर 7 डेज के लिए 1 वीक प्रोग्राम है। लेकिन दो जो है ना शॉट्स दो साइड पे 28 दिन के बाद ऑप्शनल है कि आप लगवाएं या ना लगवाएं। लेकिन अगर 1 वीक प्रोग्राम है आपका कि 1 वीक में आपने जो है कंप्लीट करना है, तो 0 डेज पे फोर साइड्स पे वन जो है इंट्रामस्कुलर डोज 1 ml ऑफ इंट्रामस्कुलर डोज लगेगा। दो साइड्स पे 0.2 या 0.1 ml 7 डेज के बाद लगेगा, और फिर ऑप्शनल है कि आप 28 दिन के बाद 0.2 और 0.1 जो है ml पर साइड पे एक डोज ले लें। दैट विल बी क्योर योर द डिजीज। Mostly the imported vaccines are available for against the rabies virus. Purified viro cell vaccine, that's a Virolab. The posture Murex cannot, the purified duck embryo vaccine, the Lysavic in बर्ना स्विट्जरलैंड से आती है। ये प्यूरिफाइड इक्वाइन रेबीज इम्यूनोग्लोबिन, ये भी स्विट्जरलैंड से आती है। और बायोमिरेक्स जो है वो फ्रांस से आती है। और ह्यूमन रेबीज इम्यूनोग्लोबिन हायरिस, ये जो है यूएसए से आती है। Mostly we are importing the vaccine like purified virocell vaccine, ये VRV भी कहलाती है, वीरो रैप के नाम से आती है। और वाइल्ड ये जो रेजिमेंट हम यूज करते हैं उसको 804011 रेजिमेंट कहते हैं। ये चिक एम्ब्रियो से बनाई जाती है। और रेबीक्यूआर जो है ना जो है वैक्सीन भी आती है। और तीसरी जो वैक्सीन है वो वीरो एमवॉक्स कंसिस्ट ऑफ ए आईडीडर्मल इंजेक्शन। तो मोस्टली इंट्राडर्मल जो इंजेक्शन हम लगाते हैं ऑन द 0 डेज पे 8 साइट्स पे ये जो है वैक्सीन लगाते हैं, लाइक प्यूरिफाइड वीरो सेल वैक्सीन। और 4 साइट्स पे जो है ना 7 डेज के बाद लगाते हैं, और 1 साइट पे जो है 28 डेज के बाद और 90 डेज के बाद। 4 डोजेज लगते हैं, 4 विजिट्स होती हैं, और ये फिर क्योर हो जाता है। The human being is being immunized against the rabies. That can be this can be applied even the dog has not been bitten to you. If you are working with the dogs, your engagement with the bears. So if you are the a veterinarian, you should be vaccinated against the rabies if you are serving to a pet. So the TRC is a 220011 regimen approved by the WHO, and that is a Rabies is consists of an intradermal injection at 2 different sites on 0 days, then 3 days, then 7 days, and then the one site on a day 28 and day 90। तो इसका जो तरीकेकार है जो WHO ने अप्रूव किया है रेबीवेक का, वो यह है कि आप इंट्राडर्मल जो है 0 days पे 2 sites पे देंगे, और 3 days पे 2 sites पे देंगे, 7 days पे 2 sites पे देंगे, और फिर एक एक साइट पे 28 और 90 दिन के बाद देंगे. देन यू विल बी immune against the rabies. So there will be no chance of producing a post rabies. So lack of resources and technical expertise, mostly the reason of failure to control the rabies is that we don't have a resources, we don't have a technical expertise, and then the inability to control and increasing stray dogs. और stray dogs को हम control नहीं कर पाते population को, and that is resulted in a less effective control of the rabies in Pakistan. पाकिस्तान में जो हम rabies को control नहीं कर पाते, उसकी वजह ये है कि government is not giving a full stress or a full concentration to the controlling of the stray dogs and the population of the dogs and the cats in the street. और दूसरा ये है कि they are not even providing the vaccine against the rabies and the cats or the animals against the rabies. The government is purchasing the vaccine for hemorrhagic septicemia, for foot and mouth disease, for enterotoxemia, for anthrax, or for caprine pneumonia, but they are not purchasing in all over the Pakistan, because this vaccine is being provided from the imported from other countries, and they are not purchasing it. Even they are purchasing all the vaccines and all the drugs imported or even locally made from the budget, but the government is not allocating the budget for the rabies vaccine, and as well as for the vaccine of the canine distemper, parvovirus, or parainfluenza, and as well as the hepatitis. So they should have to allocate the budget because this is vital and important vaccine that is not only preventing the spread of the rabies in the animals, but the source of spreading is a dog, stray dogs, and stray cats in Pakistan. And if you are not going to control the rabies in the dogs and cats, then you cannot control the rabies in the human being. आप इंसानों में रेबीज का स्प्रेड नहीं कंट्रोल कर सकते जब तक आप सोर्स को बंद नहीं करते, जब तक आप डॉग और कैट और बैट्स एंड फॉक्सेस एंड फेरट्स को आप वैक्सीन नहीं करते. So this is the only source of controlling a rabies is a vaccination and control of the population. Stray dogs or stray dogs. और दोनों चीजों पे जो गवर्नमेंट ऑफ पाकिस्तान है उस पे कोई emphasis नहीं है. तो उसको कंट्रोल करने के लिए they should have to utilize the human resource, or the government should have to start to control the stray dogs or street cats in Pakistan by the neutering and by castration, and as well as they can even control the rabies by a vaccination program. So I hope that the government will listen this one and also allocate some budget from their purchase of the vaccine again for the dogs and cats, and as well as this is not only for dogs and cats, but it is also for the large animals and domestic animals which are vaccinated against the anthrax, against the foot and mouth disease, ashes, but they are not vaccinated against the rabies, which is the potential disease which may have to spread among the human being. तो इसका मतलब ये है कि वो हमारी जो पॉपुलेशन है, ह्यूमन पॉपुलेशन है, उसके लिए भी थ्रेट है. तो गवर्नमेंट ऑफ पाकिस्तान को, खासतौर पे लाइव स्टॉक डिपार्टमेंट को सोचना चाहिए कि why they are not providing the vaccine against the rabies and against the canine distemper, parvovirus, and why they are not vaccinating the dogs and cats, why they are not providing the vaccine on the government hospitals with, to the veterinarians to vaccinate all the dogs and cats and as well as the domestic animals against the rabies. So a multi-sectoral approach is needed to decrease the rabies incidence in Pakistan. If you want to control the rabies and eradicate the rabies from the Pakistan, then you have to allocate the budget and as well as to purchase the vaccine for the not only for the human being, which is being provided free of cost at the human hospital or a public government hospitals, but you must have to provide the vaccine against the rabies for the animals at the uh, government hospitals of a uh, animals and as well as to the public sector, and the veterinarians should have the facility of keeping the cold chain of the for the vaccines to be kept in the hospitals, and they should have to provide the cover against the rabies and as well as for other diseases in the dogs and cats as well as in the animals. Public healthcare practitioners education on a prompt and appropriate post-acute treatment, especially the use of a cost-effective cell culture intradermal regimens is needed urgently. हमने पब्लिक हेल्थ सेक्टर को जो प्रैक्टिस करते हैं उनको बताना चाहिए कि हम पोस्ट एक्सपोर अगर किसी बंदे को किसी पागल कुत्ते ने या कैट ने या फिर एनिमल ने काट लिया है, तो उसको किस तरह से वैक्सीन किया जाए और उसकी वुंड को कैसे ड्रेसिंग की जाए. That must be the training should be provided to the peoples working on the health sector. So that may have to prevent the acquire or the spread of the uh, uh, रेबीज. तो रेबीज को का तरीका है, एक तो वैक्सीन प्रोवाइड करें और दूसरा ये है कि अगर किसी को किसी डॉग ने काट लिया है तो उसकी वुंड हीलिंग के लिए, उसके ड्रेसिंग के लिए, उसके क्योर के लिए, उसका वुंड ठीक करने के लिए उसकी ड्रेसिंग प्रॉपर होनी चाहिए और उसके साथ साथ उसकी वैक्सीन होनी चाहिए इमीडिएटली. और द नेशनल इंस्टीट्यूट ऑफ हेल्थ शुड टेस्ट द इम्प्लॉयड वैक्सीन पोटेंसी और फिर इंडिपेंडेंट एजेंसी को अपॉइंट किया जाए कि दैट मस्ट हैव टू मॉनिटर द स्ट्रेटजीज ऑफ ए वैक्सीनेशन एंड मेंटेनिंग ऑफ द कोल्ड चेन ऑफ द vaccine in the hospitals and as well as in the veterinary hospitals. Sheep brain vaccine should be replaced by the locally manufactured second cell generation cell culture rabies. जो हमारे पास जो locally manufactured vaccine है वो sheep brain vaccine से replace की जाए, because the cell culture rabies वैक्सीन जो है, जो 14 टीके लगते थे वो अब बंद किए जाएं. अब 5 शॉट वैक्सीन आ गई है, 4 शॉट वैक्सीन आ गई है और 1 वीक कंट्रोल प्रोग्राम आ गया है. तो वी शुड हैव टू प्रोसीड टुवर्ड्स दैट वन. द प्यूरिफाइड इक्वाइन रेबीज इम्यूनोग्लोबिन should be manufactured locally to meet the national needs. Or furthermore, effective dog control strategies should be implemented to decrease the rabies reservoir. Or lastly, the government of Pakistan should allocate the budget for the purchase of the uh, rabies vaccine for animals, and as well as there should be a locally manufacturing of the rabies vaccine in the animals, because the manufacturing of the uh, rabies vaccine for a human is carried out in Pakistan, but there is no any single anti-rabies vaccine is being manufactured in locally in Pakistan to meet national needs. तो इसलिए ये जरूरी है कि हम जो है अपना लोकली एक प्रोग्राम बनाए, उसको जो है हम वैक्सीन बनाए, एंटी रेबीज वैक्सीन बनाए लोकली फॉर एनिमल्स, एज वी आर प्रोड्यूसिंग एंटी रेबीज वैक्सीन फॉर एनिमल्स. और इसके साथ साथ हमें न्यूट्रिंग और जो अपना कैस्ट्रेशन का जो प्रोग्राम है, न्यूट्रिंग का प्रोग्राम है, वो ईयरली जो है फ्री ऑफ कैंप्स लगनी चाहिए, फ्री ऑफ कास्ट करनी चाहिए। स्ट्रीट डॉग्स पे जो स्ट्रीट कैट्स एंड डॉग्स हैं उसको हंट करके उसको जो है पकड़ के उसको न्यूट्रिंग करनी चाहिए। एंड देन वी शुड हैव टू कंट्रोल द पॉपुलेशन ऑफ the animals, and as well as we can control the rabies in Pakistan। और हम 155 कंट्रीज में से हो सकते हैं अगर हम स्ट्रेटेजीज, अगर हम पॉलिसीज चेंज करें। हम ह्यूमन के लिए, पेशेंट्स के लिए ट्रीट करने के लिए वैक्सीन है, वूंड ट्रीटमेंट है, लेकिन प्रिवेंट करने के लिए हमारे पास कोई टूल नहीं है। हम बीमारी तो फैला रहे हैं, बीमार को ट्रीट कर रहे हैं, लेकिन बीमारी को कंट्रोल नहीं कर। तो इसका मतलब यह है कि we will be failed if we are not going to change our policies, if we are not going to change our strategies for controlling and eradicating the rabies. We will be failed to control it up to 2030, and we will not be included in the 155 countries which has controlled the rabies in their countries. So I hope that if we change our policies and government may have to stress upon it, then definitely we will control the rabies in Pakistan. Thank you very much.